What is a macular hole? We have heard of retinal holes. Those are holes in the periphery, in the outer portion of the retina. The retina is the back portion of the eye, which is the nerve of the eye. If you have a macular hole, because it is right in the center of the retina where we see from, your vision is going to be affected. Whereas in retinal holes, your vision is not going to be affected. It can be there for years and you would not even know about it. But here, vision drops. Now this happens in one eye at a time. Visual acuity comes down and there will be a negative scotoma in your visual field. So how do you test for macular hole? Right at home, you can just look at a tube light with one eye closed. And if you see that there's a gap in the tube light, you're not able to see the tube light completely, you could be having a macular hole. Now, what do we do about this macular hole? You see a retina specialist, and once it is diagnosed on an OCT scan, the type of hole, the stage of hole is detected, and you will most likely require surgery. Now, in this surgery, we attempt to close the hole with something called an ILM peeling procedure, and gas or oil is injected, and you will be given some amount of face down positioning for a few days. And with this, your hole closes. Now, is it possible for your hole to reopen after the surgery? Yes, that is also possible. That is very, very rare, but that is also treatable with another surgery.